Welcome back to Power CEOs, the truth behind the business. If you're just tuning in, you're going to want to go to nowmedia.tv, go to Power CEOs and click on the show. Catch the first half of the segment because we are talking about really hot topics today. We are talking about healthcare. How do we improve the health of our country, the health of our nation? How do we improve patient outcomes? And what role does AI or generative AI have in this from an application standpoint? Right before the break, we were talking about a couple of the insertion points of where AI can fit in clinically. Maybe it's in the diagnostic process, pulling the data, pulling that together very rapidly to assist in diagnosis. What we are not talking about is replacing specialists and physicians. They still are necessary in the process. What we're talking about is really saving time, energy, and making things more effective, more efficient along the way. So I'm going to dive right back in. We have Shubho Chatterjee here. He has been in this space for decades. He has been a part of technical solutions in the healthcare industry, amongst other industries, for many years, and this is his area of expertise, so I'm really excited. Shubho, if you can dive in, maybe let's take it a little bit more granular and talk about some case studies or some use cases where generative AI fits and how it actually helps and what is the ultimate result of utilizing it in the clinical process.
Yes, so thank you. So I'm going to talk about, basically a teaching hospital, a case of a teaching hospital, and three different areas. So essentially you have the teaching hospital consists of a medical group, a business school, facilities, and other affiliates. And so one of the areas was in course enrollment, learning and management systems. So these were conversational IQ bots, okay? And so the areas that were addressed was course availability, enrollment, LMS, meaning learning and management support, which means going into and delving into all of the corpus of data that is available and coming up with additional documents. And then, questions on documents, questions on payments, and so on and so forth. Course performance. And once this was deployed, and so essentially the development time was between 6 to 9 months, and then it was a phased implementation. And so the first break-even time we found out after the initial deployment, we went through a soak-in period, and after that the break-even time was about 3 months. And then ultimately it was realized that they had a 5x ROI, and with the online educator currently saving over $1 million a year. Okay, so this was one segment of it, and there were two others. One was HR and procurement. So procurement had to do a lot with vendor management and auditing according to SOX and compliance, onboarding, offboarding. And so all of these, and as you know, procurement is a very, very complicated process involving lots of vendors and stuff that you buy, you're managing your accounts payable, accounts receivable, and so forth. And so the things that were done were assisted in course enrollments. And mind you, this was a mix between RPA and GAI, okay? So course enrollment, student registration, grant administration, and during grant administration, you went through some actually rule-based checking. And so in brief, you had about 1 to 1.5 times ROI. Break-even was 4 months, and savings for other educators were between 150 and 225K.
And then finally, tremendous. I just want to highlight that, if that's possible, to highlight, you've given us 2 use cases already, and it is an investment up front, and there is a process to integrating this into learning. But once we have that integrated and learning, the break even is only a couple of months before we have massive savings. So one of the things we talked about very early on in healthcare was the cost is exorbitant and we're getting poor outcomes. So So everything that you've shared with us has been on the, hey, this is the cost savings in the healthcare learning space, in the learning and teaching hospitals. I'm curious because the question that I know is going to come from our listeners and viewers is, great, I see cost savings, yes. What about patient outcomes?
Yes. So if you typically look at this, can be, we in this case study, we directly did not link it to patient outcomes per se, you know, but if you can clearly see that, if let's say in procurement, the clinicians don't have gloves and needles when they need them, the patient output and the patient quality is suffering. So in terms of direct outcome on bending the cost curve, yes, there's a lot of cost savings. And on the patient side, you're basically, your procurement services and your learning systems for the nurses, they all help out if you can synergize them. And that was the goal, that you just don't take it as an island by itself individually. Okay, so you combine them, you combine procurement, you combine learning and management holistically, so that overall you bring the forces to bear to yield, to go to the final outcome, which is quality of patient care.
Absolutely. I just want to reiterate this because it's so critically important. What we're doing is we're taking the mundane tasks, accelerating them tremendously using technology. So we have better data available, we have improved procurement, we have the right tools, the right everything that we need right there for the point of care, which elevates the client experience, the patient experience. So when people are thinking about this, we're not replacing the clinicians. What we're doing is we're keeping the clinicians doing what they do best, getting them the right data rapidly so they can make the right diagnosis and really be focused on that patient interaction and bring the humanity back to medicine, because that's one of the biggest challenges with burnout. We're spending a lot of time, they're rushing us through all of our patient time because it takes so much time to do everything else. What we're doing is we're rebalancing the scale and taking those mundane tasks or the tasks that take a lot of time out of the equation for our clinicians, so that they have that data immediately, can make the right decision more rapidly, have the tools that they need in hand so that they can deliver the best quality care and have a better outcome for the patient. Was that a great summary?
That was a great summary. Just add one more thing, Jan. What it does actually is, you're doing stuff on the back end, right? In this case, procurement and learning and management system. What it does on the front end is releases the capacity of people to do something more value added, in which case it is basically, in this case, being patient care.
Mm-hmm. And what is the impact, in your opinion, on retention of employees on the administrative side now that we're doing that? Because what I'm hearing is a lot of times it's the admin staff or the assistants who are doing some of this work, and what we're doing is we're taking kind of the stuff that nobody likes to do, and giving them more high value work to do. What is the impact, do you believe, on retention, staff retention? Because that's a huge critical problem to solve right now in healthcare.
Yes. So first of all, it addresses, the burnout question that you raised. It's taking away mundane work and then allowing the individual to grow professionally. And everybody, I would say, likes that, to grow professionally. So therefore, retention becomes less challenging, because you're giving people the opportunity to learn additional things and to learn additional capabilities and use it for patient care and healthcare delivery.
And I'm going to ask a follow-up question of you, because using the case study that you did, a lot of it was for teaching hospitals. And one of the things, I was a clinician, I was in medicine for 20 years. One of the things that brings specialists great joy is the ability to mentor the next generation and to also learn from the next generation. And what has happened here is you're taking a lot of the things that we don't like to do as clinical instructors, if you will, off of our plate, so that we can really focus on the soft skill side and the diagnostic side of medicine. And so I'm just going to speak from my experience and ask you to corroborate or to add to this. When we're clinically instructing, if we have to be doing all the stuff we don't love that they can actually do academically or learn in another way, it takes away from our ability to have the crucial conversation with perhaps that terminal illness that we have to deliver the bad news to that poor patient, like we're able to help our mentees to move through the human side of it in an empathetic way, whereas we were rushed before. Anything to add?
Yes, absolutely, 100% right. What it does, like I said, is it releases your time to do something more worthwhile, in which, in this case, it is to mentor and to learn. And that is absolutely correct.
Thus actually even improving the job satisfaction of the clinicians and really allowing us to get back to doing the fulfilling work that we went into medicine to do to begin with. I think that's super
Mhm.
amazing. We're about to break again. Just before the break, I want to just ask Shubha, what is the first step that people can take if they're running a practice so that they can start this process?
The first thing is actually either to learn themselves if they have the time, and we've talked about, how they don't. The other best way is to actually engage with people who have done it and know how to do it, because just like with every new technology, and please don't, misinterpret my terminology, but you've got a lot of snake oil salesmen willing to sell you the latest. Okay, Chat GPT, use Chat GPT. Don't do that, because it not only takes you on a wrong track, but it can be very expensive and very frustrating in a hurry. So be careful.
So,
Get the help of people, learn, take your time, and then do it right.
absolutely. Take the time to learn, talk to people who have already integrated it, and move forward. We do have to take a brief break. We will be back after these messages.